So let's talk about borderline personality disorder, or BPD. It's one of the toughest conditions to treat in all of mental health. For decades, the main tool we've had is psychotherapy. But what happens when that doesn't work? Because for almost half the people who try it, it just doesn't. This is a huge puzzle, and today we're going to try to put some of the key pieces together. Okay, let's start with this number, 45%. According to a recent major review, that's the average rate of people with BPD who don't respond to psychotherapy. Think about that for a second. That means almost half the people who are brave enough to ask for help, they don't get significantly better. This is way more than just a statistic. It's a huge gap in how we care for people, and it's exactly why everyone, from patients to scientists, is scrambling to find better answers. So, to really get why treatment is such a challenge, you've got to understand what BPD is all about. It's this really complex condition where emotions can feel like they're on a constant roller coaster. Relationships are often unstable, and impulsivity is a big factor. Grasping this is key to seeing why a simple talk it out approach just doesn't always cut it. All right, so section 1, why does therapy sometimes fail? If you really want to know why something isn't working, why not just ask the people it's supposed to be helping? A 2023 study did exactly that, and what they found is pretty revealing. Turns out the problems often start way before anyone ever steps foot into a therapist's office. This quote from a patient in that study, wow, it just gets right to the heart of it, doesn't it? Therapy only works if you are safe, stable, and supported. I mean, think about it. Therapy asks you to be incredibly vulnerable, to open up about your deepest stuff. But how can you possibly do that if you don't even feel safe in your own life? Patients are basically saying that the real hard work of therapy needs a solid foundation, one that's often just missing. And here's what that missing foundation actually looks like in the real world. Patients talked about these massive external hurdles, things like not having a safe place to live, not having a support system of friends or family. And then there's the practical stuff, right? Like endless waiting lists and therapy costing a fortune. The key takeaway here is that these aren't just minor inconveniences. For patients, these are deal breakers. Therapy can't even begin without them. Okay, so let's say you clear all those external hurdles. Even then, patients talked about this really personal internal journey they had to go on. It's like a 3-step process. First, they had to stop denying they needed help and that they actually deserved it. Then comes this incredibly tough part, taking some responsibility for their own role in their problems. And finally, they had to commit, really commit, realizing that this is hard work and it doesn't just happen for an hour a week in an office. So imagine all of that is in place, the external support, the internal readiness. It all still boils down to this one crucial thing. Patients kept talking about this click with their therapist. It's this gut feeling of safety and trust that happens almost right away. As one person put it, it's either there or not there. And if that connection, that feeling of safety isn't there, the real work just can't get done. It's a non-starter. Okay, section 2, a new tool from the lab. This is where things get really interesting. We've heard that the foundation for therapy is all about psychology, right? Safety, stability, trust. But what if a key to building that psychological foundation could actually be found in our biology? What if we could use a tool, something from a lab, to help create the exact conditions patients are telling us they need to get better? And that question leads us straight to a really fascinating clinical trial happening at Yale University. They're looking at a drug called ketamine, but they're not just asking, does this help with symptoms? They're asking something much bigger. Can this drug actually change the brain's ability to change itself? Now, to test something like this, you have to be really smart about how you design the study. They're not just giving some people ketamine and others a sugar pill. Nope, that's not good enough here. They're using something called an active placebo. In this case, a drug called midazolam. And why do that? Well, because midazolam gives you a similar sleepy, disoriented feeling to ketamine. It's so clever because it means nobody, not the patient, not the researcher, can easily guess who got the real deal. This is how you get results you can actually trust. So what are the researchers actually hoping to find out? Well, they've got 3 main goals here. Number 1, is ketamine even safe for people with BPD to take? First things first. Number 2, can it quickly turn down the volume on suicidal thoughts, which is a huge and dangerous part of the disorder? And number 3, can it actually help with social functioning? Can it make it easier to connect with people in a healthy way? The whole scientific idea behind this trial rests on this amazing concept called neuroplasticity. Basically, it's the brain's ability to physically change and rewire itself. Think of it like this. Your thoughts and habits are like well-worn paths in a forest. The more you use them, the deeper they get. Neuroplasticity is the brain's superpower to carve out brand new paths. All right, section 3, opening a window for change. This is where we bring the two sides of our story together. On one hand, we have patients telling us loud and clear, I need to feel safe before I can change. And on the other hand, we have this drug that might literally make the brain more open to change. So the big question is, can one unlock the other? And this quote, right from the official trial document, this is the whole game right here. The scientists think that ketamine creates a temporary window of neuroplasticity. It's like for a little while, the brain becomes more flexible, more like soft clay, ready to be reshaped. It's an opportunity to break out of those really rigid negative patterns that are so characteristic of BPD. Which, of course, brings us to the million-dollar question. Could this biological window be the very thing that helps create the psychological safety that patients told us they desperately need for therapy to work? I mean, if the brain is literally more open to making new connections, could that make it easier to form that vital click with a therapist? Could it build the trust that patients say is absolutely everything? Now, we have to be super clear here. This is not some magic bullet, and the risks are real and serious. The trial protocol itself lists the most serious potential risks. We're talking about things like severe breathing problems, the potential for addiction, spikes in eye pressure, and increases in blood pressure that could even lead to a stroke or heart attack. This is a powerful drug, and there's a very good reason it's being studied under strict medical supervision. So, after looking at all this, where do we land? On one side, you have the deeply human experience of patients saying, I need safety and connection. On the other, you have this cutting-edge scientific tool that might just open the brain up to creating that connection. It really makes you wonder, doesn't it? Maybe the future of treatment isn't a choice between one or the other. Maybe it's about bringing them together. A future that is both chemical and conversational.